Okay, good afternoon to you all. So we are meeting after a long time in live classes here. So I think after 3 weeks we are meeting in a live class. Uh, Thank you for joining this free class as well as launching this Maura education platform. So first of all, I need to thank my students who achieved uh, very nicely in last Viva exam, right? So as you all know, so far, the obstetrics and gynecology pass rate was like 30 to 35 percentage overall pass rate. But last time, everybody witnessed, right? So the pass rate was like 75 percentage. Overall pass rate was 75 percentage, and um, it is the first highest pass rate subject among the other subject, medicine, pediatric, general obs, surgery. So actually, general obs is higher pass rate. So everybody know, right? So how it possible, right? So from 30 percentage pass rate to just with the single exam, we come to 75 percentage overall pass rate. How it is possible? So what is the reason? What was the mistake? Why students couldn't pass up to now? Last maybe up to now, even a single year, they don't have a higher pass rate than 35 percentage. But this time we could achieve to 75 percentage overall pass rate. So the problem is now only the students start to understand the exam, start to understand the subject. So basic knowledge, rational thinking, those are the most important thing, right? So the students are good, you have a good knowledge, but you don't know how to apply your knowledge in the exam. You don't know how to understand the subject from the fundamental, right? So what I didn't do much things. I just make the students to understand the subject, and I just tell them how to do the exam. So ultimately what has happened, the pass rate was 75 percentage. It means the first place among the other subjects, right? But in my students, among my students, in passing students, so roughly around 410 students came for YY students. Two, 392 students got through, like almost like more than 90 to 95%. So almost all got through the exam. How it is possible? Because they know the subject, they know how to present, how to take the history, how to do the examination. So we have done a nice job in DGH Mulati, right? So all the students come all the way from Colombo and other part of the Sri Lanka to do the practical sessions, and we have done practical session in Mulati. We arranged the practical session in Colombo as well. So everybody knows how to handle the patients, how to do the examination, what is the proper technique, and ultimately it's paid off, right? So we had a good pass rate. We had a good pass rate, right? So not only this Viva, also we prove it in the MCQ as well. So in MCQ we had actually the overall pass rate is 57.6 percentage, I think. So among them, my students more than 90 percentage got through. So how it is possible? Because students started to study. They love obs and gynae these days. Earlier it was a very difficult subject and they don't like obs and gynae. Now the students really like to study the obs and gynae, right? So that is the only reason we could achieve the pass rate. So I need to thank all those students, and I'm congratulating them to achieve for the achievement, and of course I'm expecting them as a good doctor to this country. So they will be a good doctor because they know how to think rationally, and they know the basic knowledge. They know how to behave a smart doctor in their career, right? So when they become a house officer, what to do, what not to do, right? How to communicate, everything. So this is not a subject. This is only for the. This is not only for the exam. It's your life. So until you die, you are going to practice this. So you need to understand that. And I'm willing most of my students to become consultants as well. So of course, I can't directly help you to become a consultants in other aspect. But if you want to become a VOG, of course, contact me. I will help you, right? So that is my expectation. So all of my students want to become consultants as well, right? So we actually have started this ERPM career long ago, like 4 years ago, more than 4 years, 5 years now. But because of course this corona is doing a lot of bad thing, but of course corona does some good thing as well. So the most important thing is it's introduced the online system, right? So now we all are studying when you are at home, right? So even you don't want to come to Colombo, you don't want to stay in Colombo, right? So, and of course you can start your career when you are in your student period, when you are a medical student, right? You can start your career, you can start your classes even when you are in abroad, right? So local students or foreign students, like whoever they want, they can start bit early, and you have opportunity to attend to the class repeatedly, right? So you can come to the class several times, and of course when you come to the ERPM exam, it won't be a big issue for you, because you have enough opportunity to study this subject. But even though we have few issues, right? Even though we are having kind of course, these online classes are better than the live classes, as you could start your career bit early, you could start your classes bit early, but we have some drawbacks. Like, say for example, so we are struggling with these electricity issues, right? Sometimes when we are doing the classes, electricity problem is internet interrupt. Or sometimes you might have university classes, you might have hospital appointments, you might have your personal problems, like maybe some maybe like some function or something you won't attend, so you couldn't attend to the class. So what we are doing up to now, we are doing the restreaming, right? So the students who missed the class, they are going to the restreaming. And another problem is, now some students are like they are in abroad, so we have few when we are conducting the class, we have few issues like uh, time differences. Say for example, if you do the classes in the morning 8 o'clock, so for the Russian students, like we are facing some difficulties to attend to the class. It's early morning, right? So some students are attending to my class from UK, so they couldn't attend. Why? Because it's very early morning. So we have few issues related to these time issues. So as we have these problems and these time issues and your personal problem, internet, electricity, we have a lot of things. So how to overcome this? So I have a question. Whether when you are studying, of course, as a teacher, I need to help you. I need to find the way to sort out all these problems. So I wanted to do something to sort out all these problems. So then only we started to develop this more education. So we are happy to introduce that today, right? So, but I will explain you how to log in and how it is going to work and things. And first of all, you need to understand and you need to know what are the benefits and what are the advantage and how we develop this one towards the students, because there are so many advanced features. Actually, it took almost more than 1 year to develop it, and we need some more time to develop some other features, right? So it's on process. Maybe in a week time we will introduce it, and it is going to be completely automated. So you don't need to depend on the coordinator, you don't need to text to the coordinator, you don't need to wait to the coordinator's response, and everything is automated. So it's kind of a different platform. So I tried maximum to give that to you in a nice way. And I'm expecting you to, so first I will explain you the features and you can start to use it, and I'm expecting you to give the feedbacks and correction. So we can do, as it is the initial phase of development, we can do the adjustment further to make it easy for you. So I feel this user interface of this More Education platform is going to be very easy, and you can easily handle this one, and it is going to be lifelong access and 24/7 access. It's not only for your exam. This is my expectation. So I need to help to my students until they practice medicine. So not only for your exams, after you finish your exams, when you are practicing as a doctor, when you are working as a house officer, even when you are become a registrar, senior registrar, right? So when you are doing these kind of things, right? So you might have some doubt. Okay, what is the management of, if it is a breach in labor, 5 centimeter, what to do? You might forget. So then what are you going to do? You are going to go and you need to check the book, or maybe you might call to someone. Here, no need. The solution is in your handphone. So you just log into the More Education. You just go to the breach management. There are text. There are guidelines, summaries. There are video demonstration. There are classes. So you can easily access. You just go to the topic, and you just go through your relevant part only. You don't need to go everything. Just go to that and see that particular things, and you can manage the patient. When you are doing a question as a medical student, you have a question in management of labor. Just go to that management of labor part, second stage of management labor part. Just see the management part and answer your question. So it is available anytime, right? So even though you complete your exam, even though you become a doctor, still it is going to help you. So the first feature I want to give you is this access should be available to you until this More Education existing. Okay, until this More Education existing, this theory classes will be available for you. So most of the courses will be available for you anytime. And I'm going to do the live theory classes twice a year with your exams. When I'm doing the live classes, you are eligible to attend to those classes with free of charge. You can attend to the live classes as well. Even though there are recorded stuff, you can access the recorded stuff. Still, you can join to the live class as well. But up to now, if you go through the More Education, I will explain you. You can see more than 2,000 students already enrolled to the theory program within a year time. So once we start, so we started the online theory program last year. Within a year, we have almost like more than 2,000 students already enrolled into that theory program, right? So when I'm starting the live session, right? So you don't need to every students, even some students might go through, they are using this application to update their knowledge, right? Yes, right, update their knowledge. So each and every students will not get the Zoom the live class notification and things, because it might disturb you. So only the students who are willing to join to the live classes will get the Zoom link notifications. So you will not get any Zoom link to your email. These live class notifications will be present in your, it will be there in your user account in your platform. You can go to the platform and you can join to the class. So all the live classes will be conducted through the Zoom, but it is incorporated into the More Education. So you don't need to worry about the data consumption of Zoom classes, because still you are going to use the Zoom, but through the platform, right? So you will not get any live Zoom class link, but still you will get the class icon through the platform, so you can access the classes through the platform, right? So so how to join to the class, I will teach you. I will tell you how to join to the classes. So it's again, it's automated. So you can choose your live class batch. You can go to the batch and you can select the upcoming live class batch or current live class batch. So then the students who are in that particular batch only will get the Zoom link and you will join to the classes, right? So the first advantage is until the more education exists, you will get the class accesses. So my duty is to update the theory part whenever the guidelines and the evidences are changing. I will update the new things. When there is a new guideline comes, I will update it. So then you will get the notification, and even when you're working as a house officer, you can go through it. Okay. So that is going to be a continuous learning process. So you are just going to pay for once and you are going to continue to learn is obstetric. So this is not only for the exam purpose, not only for the classes purpose, it is a continuous obstetrics and gynecology learning process, right? So you are going to learn continuously until your career, you stop your career. And of course, you are preparing this for the ERPM or maybe PLAP or maybe AMC, whatever the license exam, you can use this one. Local students, whoever, even the postgraduate students, whoever they want to learn the obs and gynae, yeah, they can learn it. Right, so all pre-recorded things are here. So basically, this is going to be an offline and online learning platform. Basically, this is going to be an offline and online learning platform. So there are stuffs in offline and there are stuffs we are going to conduct through the online, right? And of course, you can access questions, you can do the questions in the platform, everything, right? Okay, so first, I will give the initial brief introduction, how to log in and how to access the classes and how to join it. So here, as we have already 2,000 students enrolled in the theory, we need some time to for the initial process, because if somebody wanted to join first time, right? So you don't have any problem. Everything is automated. You can just log in, you can give your detail, you can buy the courses, everything is automated. But the students, pre-existing students, already attended students, we need some clarifications to give the access to you. So you can create your user ID, but the thing is, we have to manually clarify whether the same person is attending to the class. So that will be done by our coordinator. So at the initial part, so once you clarify it, then you will get the access for classes, right? So at the initial part, we need some clarification, but the students who are joining newly, you don't have any clarification, because everything is everything we do as a automated one, right? Now, yeah, some students are asking, is it good for you, sir? Because you are giving 24/7, you are giving access. So can someone do some unwanted action? Yeah. So if we are doing this kind of things, obviously, we will have some that kind of security as well. So we have some security monitoring, right? And of course, this is a intellectual property, as you know, so it is a registered company. So if somebody do some unwanted things, so definitely there will be a legal action. More than that, when you are consuming this course, there are some security things. So you have to use this when you are consuming the paid courses. So here we are having two kind of courses. One is free courses, and there are some paid courses like your theory, mixed paper, topic-wise revision, right? So those paid courses, premium courses, when you're consuming those premium courses, you need to download the app. You can't watch it through the web. But the free courses, of course, you can watch through the web, but when you consume the paid courses, you need to download the applications. Now, the application is available only for the Windows and MacBook, right? So in 4 to 6 weeks time, the application will be available for the mobile devices as well. So that is a small inconvenience, I know, but we need some time to develop it. So that is the first thing. So as it is, so first of all, you need to download the app, and actually, when you're consuming only, automatically system will lead you to download and install it, and then you can consume the courses through the app. So when you are consuming, so you can screen record, you can screen share, and of course we are monitoring. So when you are consuming the courses, you need to give two permission. One, you have to give your camera access, and you have to give the screen share access. So it will get the permission from you to get the access to monitor you whether the particular person is consuming the course, or whether some person is consuming the course. So when you buy the course first time, you have to give your you have to give your photo, right? So it will take your camera and take a snapshot, and that will be saved in the platform. So whenever you are consuming, the system will analyze whether the same person is sitting in front or another person is sitting. So if another person is sitting, your enrollment will be suspended, right? So if other person, not the suspend, your enrollment will be cancelled, right? If you are not focusing the camera, right, when you are consuming, if you are not focusing the camera, your enrollment will be suspended. So next time you can't access the class. So then if it is if the camera is not focused, if your enrollment suspend, you need to contact to the coordinator, and you have to submit the explanation letter why the camera was not focused. Then only you will get the access to the course. So this kind of explanation will be allowed for only for 3 times. If you give 3 times explanation and 4th time, your enrollment will be cancelled, and you have to pay again to get the access. So you are having 24/7 access, then don't do any illegal actions, because it is yours, your property. You need to use it, right? So when you are genuine, we also genuine. So you will get maximum benefit of these. So not only this, the students who are attending and who are joining to the class will get the chance to join to the free session, like counseling, right? And there are so many things I'm planning to do it through this platform. So please be genuine and be a member of More Education, right? So it is going to be an international platform, right? So is there any increase the speed? Yeah, of course, you have so many options. You can increase the speed, you can increase or reduce the quality of the video, right? Right. So there are so many advantages. So don't do any kind of um, unwanted thing. So if you stop the screen share, or if you stop the camera access, immediately you will be thrown out from the data. So you're the course consuming. So you can't consume the course, right? Even when you are attending the Zoom class through the app, right? Even if you stop your screen share or camera, immediately you will be thrown to the platform homepage. Then you have to join to the class again, right? So these are there are so many other features. I don't want to explain each and everything. I'm creating those the explanation, so the videos and FAQ questions, so you can get to know what are the procedure and how to do those things. So now I'm going to introduce you how to log into the More Education. Yes, of course, the previously conducted classes will be available in the platform. You can join anytime, and you can join to the new classes, the upcoming classes, and the featured courses. Everything will be available in the More Education. So now I'm going to show you how will be the More Education. Right. Okay. Right. Sorry. So here, simply what you can do is you can, yeah, give me 1 minute. Right. Right. Simply you can go to www dot mauraeducation.com, or you can go to the Google and Maura Education. So this is going to be a web page application, right? So when you go to the mauraeducation.com, or you can search it in the Google, right? This is our user interface, right? So I will explain to you each and everything here. What are the things here, right? So first of all, here not only the medicine classes, so they are, this is an international platform, so they are going to conduct the other classes as well. So we don't need to worry about the other classes. We are mainly concentrating the medicine, our courses as well. So here you can see like this is our home page. So you can search the courses, right? Or maybe you can see there is another column called category. So what is this category? So there are so many courses under category of different name, like so there are courses related to development, business, finance, IT, something, blah blah things. But here we just want to know about the medicine classes. So you can just click the medicine. When you come to the medicine classes, you can see the obstetrics and gynecology courses, which is available in Maura Education. So most of the courses which is available in Maura Education is here, but it's there are, we need some time to launch these Viva classes and all, because I need to put those course material into the Viva classes. So here you can see there are some free classes, there are some paid classes, right? Yeah, there are some paid classes. So most of the classes, so all the classes which is available, or the classes which has been conducted by me, it's here. So you can access these free classes, right? In the website. Actually, these free classes does not have any security checkup. Only we are having security checkup for the paid classes only, right? So your screen share, camera checkup, everything is applicable only for this paid classes. Free classes, obviously, you need to, you don't need to log in into your desktop application or MacBook applications. You can access through the web page as well. But for the paid classes, you need to download. So the download process will be automatic. When you click the course and when you consuming the course, it's automatically download the course, right? To search and viewing the course detail, actually you don't need to be a user for this. You don't need to create an account for this Maura Education. But if you want to consume the course, either this is a free class or paid class, you need to register to the Maura Education. And the interesting thing, if you are really interested to conduct classes in any kind of this field, lifestyle, marketing, design, whatever the topic, still you can apply for the instructor post as well. That is also the extra benefit, right? But here what you have to do is you have to so if you want to see, like, say for example, if you want to see the obstetrics and theory session, yeah, of course you can see the detail of the obstetrics and gynecology theory, right? So far 2,993 students has been enrolled to this course, right? And of course, as we didn't give the access to the students, so once the students get access, you can rate the course and you can give your reviews, right? And the students, newly joining students, you can see the reviews, right? And you can check it out. What about this course, right? So what is what we are mentioning, and who are the people? The course is important for whom? Yes, you can check it out. And what are the section, and what are the topics under the section, and what about the other features? Everything about the course, of course, you can check it out. And of course, you can check the course. So here, when you are consuming the course rather than the class, here I'm not going to give as a class 1, class 2, class 3. When we are conducting the class, when we are doing the restreaming only, we will conduct the class as classes in a class manner. But here, for the students' easy purpose, I have divide these classes into topics, right? So we are having session 1. Yes, of course, we are having session 2, we are having session 3, we are having session 4, like. So when you are seeing the session 1, this session 1 has altogether 6 lectures, 24-hour duration, and which contain labor, operative procedure in normal vaginal delivery, complicated labor, breech presentation, VBAC, pelvic pain, obstetrics and gynecological infection. So different topics. When you go to the labor, then under the labor, there are small subsection like mechanism, introduction of labor, mechanism of labor, management of labor, abnormal labor management, induction of labor. Like that, it is categorized into small topics. And those videos are in a small videos. So you don't need to drag it and you don't need to load entire video. If you want a small portion, if you have doubt in labor mechanism, if you have doubt in labor management, if you have doubt in abnormal presentation, if you have doubt in induction of labor, just go to that particular topic and access it. That's it. So it will reduce your time consuming, it will reduce your data consumption as well. So it is going to be like that. So if you want to see further detail, when you click, it's automatically lead to login. So you need to log in to consume the course. So otherwise, if you don't have the account, actually you can create the account. So here, the students, we have two types of students. One is already attended students. Second one is the newly joining students who never attend to my class. So students who never attend to my class, when they want to consume in these courses, you can create the account. But the students who already attended to my class, already I have created account for you, right? So what you can do, you can activate your account by login. So it is easy for you to log in because the login user ID for the pre-existing student is your WhatsApp number, right? Your WhatsApp number is defaulted your user ID. Then what about the password? Password is, you can reset the password. Simply, you can give your WhatsApp number, you can reset your password, you will get the SMS alert to your OTP to your account, so you can reset the password. Even if you forget your password, you can simply reset. For the resetting, you need an OTP. So for that, you need to have a functioning telephone, right? Or if students does not have the account, they can create the account. So when you are creating the account, we are asking few important information. First name, if you have middle name, you can give it, but last name is mandatory. Your functioning mobile number to get the OTP, and you can give WhatsApp or Viber, whatever, right? And your email address. The profile image is optional, and your country and password. You can give your password and things. And of course, there is an option called field. What is this field? The field is, I have shown you in Maura Education, there are so many categories of classes like development, photography, and a lot of things. So here, if you select the particular field, like, so you want to know only related to the medicine, right? So then you can select the medicine only. Once you select the medicine, you will get the access, or you will get the notification related to the medicine only. If not, you will get the notification of all other courses as well. So what you have to do, you have to select the medicine, or if you like to have other field as well, then you will get the field. So now I have logged into my platform, so my account. So now I'm in my account. So when I am in my account, so I won't see all the courses. Here I'm seeing only my courses. These courses already I have enrolled. So my enrolled courses are here, right? And if there is a live class, that will be shown in a different form. So like Obs and Gynae practice exam, which we are going to start by this month end. So that is, it's going to be start soon. So you can see the live class. So you can join to the class. No need of coordinator. You can join to the class automatically by paying here. And of course, you can see the featured courses, right? So you can see the latest courses, you can see the free courses, you can see the upcoming courses, and of course, you can see the popular instructions as well, right? So everything will be categorized, and if you want to search the other courses in the other field also, you can go to that searching option and you can search it. And I will explain you something about your profile. Of course, if you are watching the platform in the night time, you can shift to night mode and you have to go to the view profile, right? When you come to the view profile, there are options that you can see. Earlier, you gave a few information only. So what you can do, you can edit your information and you can give rest of the information like your primary contact number, secondary contact number, email address, your sex, or gender, or preferred language, date of birth, everything you can give it here. Then of course you can see the field. So earlier I explained you something about the field. So here you can see all the related field. Here there are field called development, business, finance. So we don't need to worry about that. If you are only concentrating the medicine, you can just select the medicine and update it. Or along with that, if you want to know about some courses related to maybe photography or music or something, you can select it and update it. That's up to you. If you don't want, when you select this field, of course you will get the notifications and the email alert related to that courses related to the medicine and photography, the music and photography. If you don't want those kind of disturbance, you can just select the medicine and just update it, right? And while you are watching the classes, the courses, if you wish the course, you can just select the wish list, so it will be appearing in your platform. And of course you can go to the enroll list. You have two options, either paid course, free course enrollment, and paid course enrollment. What are the courses already you joined for the paid and free courses, right? So that one appear in a different, and subscription. So if you subscribe any lecturers, it will be appear here. And of course, this is a verified as Sri Lankan. So actually, this is basically we develop like as citizen on. If you are a foreigner, the course fee will be appear as $1. So sometime the dollar price might be higher than your Sri Lankan price. So in that case, what you can do, you can upload your password or NIC to confirm you are a Sri Lankan. Then the additional money you can utilize for the other courses, so you can get the money back. That is to verify the Sri Lankan. And here you can see the completed courses. If you complete some courses, you can see. And if you are studying few courses, that will be appear in active courses, and upcoming courses will be separate, and free courses will be separate. So this is your this is your profile. So I'm just showing you how will be the right. So theory. So if you buy a course, right? So okay, give me 1 minute, one page class. Right. So if I'm going to buy this course, right? So you can select it, and here when you log into the course, you can see few additional information, right? Here, so not the non-login users will not see those kind of things. Here, the information regarding the courses, what are the things, and to whom it is good, and you can see the course content. So there are mixed paper revision. It's having around 12 papers, and the first paper, one lecture, 2 hours, who is the lecturer, and those kind of things, right? And you can check the handbooks here, right? So if it is a mixed paper revision, right? So the first paper is here. So you can download it, or you can watch the mixed paper here, right? So you can watch the paper, or maybe you can download it, right? Or maybe like that, if it is 12 papers, so if actually I need to upload rest of the things, it's in a half process. So you can check it out, all the papers. And if you want to contact the coordinator, of course, you can contact the coordinator. And this is the thing I told you, the batch. If you want to join to the upcoming batch, you can select the batch and you can update it, right? And the most important part is the discussion. If you have question, if you have doubt with some question or something, you can contact to the lecturer or teacher through this discussion part. It is a simple process. What you have to do is you have to uh, type your doubts, right? And you can ask. You can simply ask. Or if you want to send a voice note, or if you want to send a voice file, yes, of course, still you can upload the voice note, or you can give a voice recording and so part, or even you can send the image, you can send the video no doubts, or you can send the file doubt. So whatever the things, if you have, you can upload it and send it to the lecturer, and lecturer will answer to your doubts, right? Even if you have you have doubt in a question paper number one, yes, of course, you can select the paper number one and you can give the doubt, right? You can write the doubt, write your doubt and give it to you, right? So this is how. And if you want to buy the course, it is simple. You just go and buy it now. When you go to the process, you can buy this course in two ways. One is you can pay by the card, either Visa card or credit card, whatever. So you can proceed with the card system. If someone does not have card system, you can go to the bank transfer system. So when you go to the bank transfer system, so you will get the bank detail here. Once you transfer the bank detail, you have to upload the slip and give a note and confirm the checkout. Once you pay this course through the credit card, it is automatic. So immediately you will get the access to the class. But if it is a bank transfer, so you have to wait until the manual verification. So after that, you can join to the class. Okay, I know I'm overloading you, but I'm just giving an idea. I will give some video demonstration to get to know about the ideas. So then not only when you are joining to those kind of courses here, like so session 1, session 2, that kind of classes, you don't need to pay entirely, you can pay separately as well, right? So I will show you like a few things like that, right? Option gyne Viva. Okay, Viva. It's a free Viva. Sorry. Yeah. Viva course, right? When you go to the Viva, right? If you want to buy, yeah, you can buy entire Viva, or you can buy session wise, section 1 only, or session 2 only, or you can buy both. So if you select complete course, you have to pay 19,000. Or if you want to buy like session 1 only, so some students already joined to the session 1. So if you want to join to the session 2, you can buy the session 2 only. So like that, you can join section wise as well. When you go to the purchase course, how you are going to access your class, it is going to be like that. Okay, right? So this is the course content, right? So you have a handbooks here, right? All the handbooks related to the session 1 is here. You can see all the notes already uploaded here, right? All the notes are uploaded here. Session 2 notes are here. Session 3 notes are here, right? Everything is uploaded here. You can download it or you can watch it. And the course content, if you want to join to the session 1, where labor, when you select the labor, it will automatically download the app and you can access the app through the uh, uh, applications, consuming the application. So I don't want to spend much time here. It's enough because you might get tired about this more education. So I will give the video demonstration and instruction PDF to you to get to know about these things. Now we are going to discuss about the free lecture topic. Give me 1 minute. Right. So now we will move to the today free theory session. What I want to discuss with you is the role of house officers in gynecological surgery. Gynecological surgery. So today I'm planning to show you surgical video as well. So how we are removing the ovarian tumor. Right. So what about the password for the pre-existing students? The password you can reset it. Oh, your password is going to be your OGR number. Your OGR number is your password, or you can reset manually. Right. So forget password. If you give the forget password, you can reset it. Right. Perfect. So now, what is the role of house officers in gynecological surgery? So the most of the students, when they are joining as a house officer, they are having a lot of problems. They don't know the procedure, right? So because you studied in a different country and you are working in a different country, the procedures are different, right? When you go to the new hospital, you don't know the places, you are not oriented to the hospital. So where is the blood bank, where is the theater, where is the anesthetic department, where is the lab? So those kind of things you don't know. So you are struggling to work as a house officer, especially in the initial part. And sometimes when you are joining to a very busy unit and the big surgical list and obstetric list, lot of deliveries, lot of cesarean section, so you are struggling to work. So if you have some idea what are the things you need to do, you can organize yourself and you can do most of the works in the previous day, and you can keep the patient ready. You can avoid get scolded by your seniors and consultant. That is most important. Second one, you need to know how to monitor the patient, how to manage the patient in post-operative period. Right. So this is not only useful for your uh, house officer period, also it's very important for your exam purpose as well, because we are we are getting so many questions regarding this post-operative management, post-operative care, how to manage, how to monitor, how frequent you are going to monitor, those kind of things. Do you understand? So you need to know about these kind of things. So in gynecological surgeries, so we can have two kind of surgeries in gynecology. One is the emergency surgery, another one is elective surgeries. Right. So can anybody say some, or maybe one example of emergency surgery, gynecological emergency surgery? Can anybody tell example of gynecological emergency surgery? Yes. Yeah, very good. Ectopic, right? Yeah, ruptured ectopic. It is an emergency surgery, right? Ruptured ectopic. Twisted ovarian cyst, ovarian torsion. Very good. Ovarian torsion. So you can have the ovarian torsion, you can have a ruptured ectopic. Those are emergency surgeries. Elective surgeries, of course, we have enough elective surgeries, right? So it could be open elective surgery, it could be a vaginal surgery, it could be a laparoscopic surgery, right? So like hysterectomy, removal of uterus, right? Or maybe simple lap and line, LRT. So we have a lot of surgeries. The problem is when you are preparing the patient. So first we will discuss about the elective surgery, then we will discuss about the emergency surgery. When you are preparing a patient for an elective surgery, so this is not applicable for the gynecological surgery. Also, it is applicable for the obstetric surgery as well as normal obstetrics, even the medical career. When you are preparing a patient for surgery, there are a few things, the standard things you need to do. In addition to that, what you have to do is you have to anticipate the complication. There are complications which can totally damage you. So if you anticipate those complications, what you can do, you can prepare yourself and you can be ready to manage those complications. Do you understand? So you need to anticipate the complication. Anticipation of complication. Say, for example, can you just tell me some complication you're anticipating and you can prepare yourself to prevent those complications? Say, for example, if you are anticipating the bowel adhesion, the patient with previous patient with previous surgery, or patient with endometriosis, or patient with malignancy. This kind of patient, if you are anticipating bowel adhesion or bladder adhesion, right? So if it is a bowel adhesion, if you are suspecting bowel adhesion, so while we are operating, we need to remove the adhesion. We need to cut the adhesion. When we are do the removal of adhesion, that is called adhesiolization. When we are removing the adhesion, what will happen? Accidentally or maybe invariably, we may have to we could damage the bowel or we could damage the bladder. In that case, patient will develop peritonitis. Even patient might die. So to prevent this kind of complication, what we have to do is we have to prepare the bowel. Say, for example, we have to keep the patient nil by mouth for a long time, or maybe a clear fluid, and we have to give the enema, maybe the alkaloids, whatever. We have to clear out the bowel content. Because if the bowel got damaged, the bowel content can leak into the abdominal cavity, peritoneal cavity, which can cause chemical peritonitis, which can cause infective peritonitis. So to prevent this kind of complication, you need to do the bowel preparation. Do you understand? So if you are not preparing the bowel, if the bowel has a lot of content, when you cut the bowel, this bowel content can leak into the peritoneal cavity, can lead to a lot of complications. So the most important part is here is to prepare the bowel content. So here what you are doing is you are preparing the patient depending on the anticipation of complication. Do you understand? Right. Or sometime, if you are suspecting the bowel mass, bladder mass or the ovarian mass, right? So you are suspecting this mass could be a malignant, but still you are not confirmed. So if it is a benign mass, you don't need to take the uterus out. But if it is a malignant mass, you may have to take the uterus out. In that case, what you have to do, you have to talk to the patient earlier. We are going to cut because the patient is under anesthesia. You can't talk to the patient early after the anesthesia. So you have to talk to the patient a bit early. So you have to tell we are going to open your tummy. When we are opening, if you suspect is a malignancy, we may have to take the uterus out. You need to take the consent from the patient. Do you understand? So you have to anticipate the complication. Depend on the complication only. You need to think about the preparation, right? So first of all, before we come to the each and individual cases, first of all, we will talk about what are the common pre-operative preparation or pre-operative assessment we are doing as a house visit. What are the things you need to do? Okay, do you have any idea about the pre-operative preparation of the patient? So the pre-operative preparation usually start well before the surgery. First of all, what you have to do is you have to do some investigation. So before you go to the investigation, so this is your common rule, right? So when you are accessing or when you are assessing the patient, what we are doing, first of all, we are taking the history. Second, we are doing the examination. We do some investigation. Then you have to do the drug optimization and you have to manage the condition or manage the complication or manage the condition which the patient is having, right? So then only you can send the patient to the theater, right? So first you take the history to the patient. So whether the patient is uncomplicated or whether the patient is having kind of pre-existing diseases like diabetes, hypertension, or maybe a patient might be on OCP. What is the problem if the patient is on OCP? If you are going to do the pelvic surgery, if the patient is taking OCP, it is a problem. Are you worrying about this problem? Yeah, of course we are worrying, because when the patient is taking OCP, while patient on OCP, if you do the pelvic surgery, it's high risk for the deep vein thrombosis. So how long you have to stop the OCP prior to the surgery? How long you have to stop the OCP prior to the surgery? It's 4 weeks. 4 weeks, 1 month. Very good. So it's an MCQ question, right? So 4 weeks. So you need to stop the OCP for 1 month prior to the surgery, right? So you have to go through the patient's history. What are the disease? What are the medications she is on? What are the previous surgical intervention occurred? So patient had a previous laparotomy for a ruptured ovarian cyst. Now again she came with the ovarian mass. Oh, she had an laparotomy for endometrioma. Now she's coming back with the recurrent endometrioma. So now you are going to open it. So if the patient has endometrioma itself is a risk factor for the adhesion and already she had an laparotomy. That is another risk factor for the adhesion. So altogether, what will happen? It will cause severe adhesion. So when you are open the abdomen, there will be a lot of adhesion. So you have to anticipate the bowel adhesion, you have to anticipate the bladder adhesion, you have to anticipate the bladder damage, bowel damage, right? So you have to prepare the bowel, you have to inform to the patient there is a risk of bowel damage, there is a risk of bladder damage, you may have to be on catheter for 2 weeks. Like that, you have to tell to the patient. So take the history, do the examination like checking the blood pressure, checking the pulse rate, regular or irregular, what about the volume of the pulse, right? And you have to do the examination. Third one, you need to do the investigation. That is called pre-operative investigation. So commonly, what are the pre-operative investigation we do? If it is a healthy woman or healthy person, you don't need to do most of the investigation. Even so, if you talk to the anesthetist, or anesthetists are telling less than 35 years, other than full blood count, actually you don't need to do anything. But if it is an elderly, yeah, of course, there might be undiagnosed diabetes, there might be undiagnosed heart disease. So you need to do full blood count, right? You may have to do the liver function, renal function test. You may have to do the ECG. You may have to do the fasting blood sugar, right? And if it is more than 60, 65 years, you have to do the chest X-ray to assess the lungs is capable to anesthetize this patient, right? So we have to do the pre-operative investigation. So depend on the causes, depend on the cases. So if the patient is having some pre-existing disease like renal disease, renal function test, liver disease, you have to do the liver function test, like that. So depend on the case, you need to do the additional investigation as well. So pre-operative investigation. Sometimes if the patient is having heart disease, so then you may have to, the ECG is not enough. You may have to do the ETT, or you may have to do the echo. You may have to get the opinion from the cardiologist, right? So first of all, you need to do the investigations. Second thing, you may have to adjust the doses or drug optimization. So if the patient is on clopidogrel, so then you can't do the surgery with clopidogrel. You have to stop the clopidogrel. So drug optimization. But the problem is you can't stop the clopidogrel your own. You need to get the opinion from the relevant specialty people, whether is it safe to stop the clopidogrel. So if the patient is on aspirin and clopidogrel for the ischemic heart disease, if you stop the aspirin and clopidogrel for the surgical process, then what will happen? Patient will develop MI and die. So you have to get the opinion from the cardiologist, whether is it safe to stop the clopidogrel, right? So aspirin you can stop prior to the surgery, but prior day to the surgery, but if it is a clopidogrel, you need to stop minimum of 5 days prior to the surgery. These are MCQ. Minimum of 5 days prior to the surgery, you need to stop the clopidogrel. Do you understand? So aspirin and clopidogrel, you need to stop it prior to the surgery. And sometimes patient might be on warfarin, then you may have to change to enoxaparin and bring down the PTINR level to the normal level. Then only you can do the surgery, right? So the drug optimization, sometimes patient might have uncontrolled diabetes, so then you may have to change the drug. You may have to change to insulin and bring down the blood sugar level, and then only you can go with the surgery, right? So you need to do the drug optimization and disease optimization. So this disease optimization, right? So the disease optimization, how will be the disease optimization? If it is a when there is a patient with diabetes, so rather than doing optimization by yourself as an obstetrician and gynecologist, what you have to do is you have to refer to that patient to the particular specialties, right? So if it is a heart disease, as I told you, you need to refer to the cardiologist. If it is a epilepsy, you may have to get the opinion from the neurologist. If it is a valve replacement, yes, of course, you need to get the opinion from. It's like that. So the relevant specialty people give. So it's actually telling in the other way, you need a multidisciplinary team input. So depend on the patient, you need to get the opinion from relevant specialty people. So you need to optimize the disease with the specialty involvement. Then what is the next part is to get the anesthetic opinion. So you have to get the pre-operative anesthetic assessment. You need to send the patient to the anesthetic department saying this patient is waiting for this particular surgery on this date. Please see this patient in view of assessing the fitness of surgery. So the patient will be assessed by the anesthetists and they will tell these are the things need to be optimized, these are the things need to be done, and you have to do those works. So you have to follow the anesthetist instruction, right? So pre-operative anesthetic assessment. Do you understand? Pre-operative anesthetic assessment. Once you assess once the patient assessed by the anesthetist, then of course you need to explain to the patient regarding the complication, regarding the surgery, regarding the possible outcome and all, and you have to get the informed written consent. So this consent can be a different type. One is just verbal consent. Say, for example, if you're going to do the abdominal examination, are you going to get the informed written consent? You are explaining and you are getting the signature to give the consent? No, that is a verbal consent. So the verbal consent is enough for the surgical, for the examination process. But if it is an invasive procedure or if it is a surgical procedure, you have to get the informed written consent. Right. So even though it is, we need the informed written consent for the surgical procedure, if it is a life-threatening category 1 cesarean section, or if it's a life-threatening surgery like ruptured ectopic collapse patient, if the patient is unconscious, actually you don't need to take the consent. Even if the patient is conscious and very urgent, you don't need time to write everything and get signature. You can do the surgery with the verbal consent, but the particular doctor who is taking the verbal consent need to record everything. So the verbal consent taken by Dr. Rajiv and you have to sign it. Do you understand? So for the life-threatening emergencies, you can do the surgery under verbal consent, but rest of the elective surgery you need informed written consent. These are MCQs, you will get it in your exams. Right? So in the informed written consent, what are the things you are going to explain to the patient? First of all, you need to explain, because this is one of the MCQ. In informed written consent, following should be mentioned, right? So what are the things need to be mentioned in informed written consent? One, you need to mention about the surgical procedure. What is the surgical procedure you are going to do it? Whether laparotomy, whether laparoscopy, whether hysterectomy, right? Surgical procedure. Second thing you need to mention, what is the mode of anesthesia, right? What is the mode of anesthesia, right? So like whether you are going to do under anesthesia, general anesthesia, whether you are going to do under spinal anesthesia, mode of anesthesia. Third one, why you are doing the same surgery? What is the indication, right? So we are removing your uterus because your uterus has a big fibroid. We are removing your fibroid because you are having heavy menstrual bleeding and pressure symptoms. So we need to tell the indication, what is the reason I'm going to do this surgical intervention? That is third one. Fourth one, you need to tell to the patient, what are the alternative options available, right? So patient might ask, why doctor, without surgery, can't you do something else for me? Yes, still we can. Yeah, we can do the alternative option. So if it is a fibroid, yeah, you can tell, we can do uterine artery embolization, right? We can give the medical management like GnRH, Udanosolv, whatever. So you need to explain about the alternative processes. What are the alternative processes which is available? So tell about the alternative process. Then, of course, you need to explain to the patient regarding the possible complications, right? So when we are operating, you might have bowel adhesion, you might have bladder adhesion, you might have bowel damage, you might have bladder damage. So tell about the complications. These complications may be intraoperative complications, or immediate post-operative complication, or long-term complications, right? So incisional hernia is a rare long-term complication. So you need to tell about the possibility and complication in a categorized manner. Then you have to explain to the patient regarding the additional process which may need it during the surgery. Like she might need intraoperative blood transfusion. So you need to explain and tell and get the consent. So while we are operating, we may have to give the blood to you because there is a risk of hemorrhage. We may have to remove the uterus if the bleeding is not settled. Say, for example, so if it is a morbidly adherent placenta, you are expecting she might bleed, or maybe a placenta previous, you are expecting a massive PPH. In that case, you may have to remove the uterus. So additional procedure need to be addressed to the patient, and you have to get the consent. Do you understand? Right? So then once you explain everything, then you have to get the signature. You let the patient to read it and ask her to write. Do you understand? So this is how we are taking the informed written consent. So I have seen few hospitals, they have a seal. I'm giving the consent for surgery. Only that is mentioned in the seal. They just seal it and patient will sign. Even patient don't know what is the surgery, why they are doing. Right. So I have seen when I was registered in a hospital, one patient underwent uh, uh, cervical biopsy. Yes, yeah, cervical biopsy. So it is suspicious of, not a suspicious, it's a cervical cancer to confirm the cervical biopsy. Yeah, I have done the surgery. So it is adhered to the rectum and everywhere it's infiltrated. So when I'm taking the biopsy, the mass is into the bowel. So rectum, it's open up. So rectal damage, she will die within 2-3 days. So then after surgery, I want to explain to the patient what is the progression or what is the problem and what could be the outcome and all. So I want to explain when I'm going to the the bystander, her father also was there. Then I was asking, why you came to the hospital? What is the surgery we have done? Then patient is telling, actually, doctor, she came with the fever. So then why we did the surgery? That's why I'm asking for the fever patient, why you have done the surgery. So where is the problem? The house officer didn't take the consent. She then only I check the ticket. It's there like a seal. I'm giving the surgery consent, and patient don't know why he is signing. Then only I explained, no, you came to the hospital because of the fever. That is the peritonitis is a different issue. But now you have a cervical CA, it's infiltrated into the bladder and bowel and everywhere. Her prognosis is very bad. Then only they know. If I am telling and if you are not explaining these things to the patient, then what will happen once the patient dies? Then the bystander and everyone will tell. So she got fever and she went to the hospital. They have done the surgery for the fever and she died. See the scenario, how it is changing. So don't do these kind of things. Right? So you have to give all the information related to that and get the informed written consent. Then, of course, you need to prepare the patient, pre-operative preparation, very few preparation. One is patient need to be admitted to the hospital and she has to be fasting 6 hours for the solid food and 2 hours for the clear fluid, right? So need to be fasting and the skin preparation, right? And the name tag, you need to put the name tag in the patient's hand and clear information, and you have to send the OT list to the patient theater, right? So there are 3 OT lists we are writing. One is for the theater, another one is for the director, third one is we usually keep with us in the ward. So you need to know how many OT lists we are filling. So it's a house officer's duty. You are filling three lists, and we are sending one to the theater, another one is to the director, third one is you are keeping with you in the ward, right? And of course, we need to give some pre-operative medications. What are the medication we are giving? There are 3 medication we are giving for as a pre-operative medication. One is ranitidine, right? Ranitidine will reduce the acid secretion. Second one is maxalone or maybe a domperidone to reduce the regurgitation. Third one is sodium citrate to neutralize the acid. So ultimate target to give this pre-operative medication to prevent the lung aspiration, right? Prevent the lung aspiration. So we are giving 3 medication. One is ranitidine, IV. Second one is maxalone. Third one is sodium citrate. You give the medication and patient need to be sent to the theater in the surgery day 2 hours prior to the surgery. Right? So that is how we are sending the patient to the theater. Then, of course, after the surgery, when the patient come back to the ward as a house officer, what is your role? So what is the first duty of the house officer when the patient come back from the theater? What is the thing you have to do first? Anyone? Any intelligent guys? What is the first thing you need to do when a patient come back from the theater? If somebody answered properly, first record what you are going to record it. check the vitals. Very good. Galaxy, I don't know the name. Very good. What we have to do is we have to check the post-operative and operative notes. We have to check the post-operative and operative notes. What is the importance of checking these notes? Any idea about this? Because you are a house officer, you are in the ward. You don't know what has happened in the theater. How was the surgery? Was it a complicated surgery? Was it uncomplicated surgery? Was there any adhesion? Was there any bowel damage? Was there any bladder damage? We don't know. Right? First of all, we need to know about the patient. We need to know about the scenario. We need to know about the complication. Then only we can plan out our management. Do you understand? So what you have to do is first you have to go through the pre-operative notes. That is the first thing. You have to go through the pre-operative and sorry, not pre-operative, operative and post-operative notes. Right? So any complication. So they can mention, they might mention like there was a bowel adhesion and the bowel damage and surgeon called and surgical repair of bowel done. So now I know there was a bowel damage. So how to manage this patient? Then you have to go to the post-operative. Keep nil by mouth until the VOG opinion. Continue the IV antibiotic for 48 hours or until the VOG opinion or senior opinion. Do you understand? So never ever forget to check the operative and post-operative notes. That is the first step. Whenever you are working as a house officer, please never ever forget to check the post-operative and pre-operative notes. Please check the post-operative and post-operative and post-operative notes and follow the post-operative instruction. Right? Then in your post-operative management, you need to check few things. So check the vitals. So the initial 1 hour, you need to check vitals every 15 minutes. Then every 30 minutes for 2 hours and hourly for or half hourly for 4 hours. So you need to check the vitals in this way. Then of course you need to check the bowel movement. If the patient bowel movement is good, if there is no contraindication for the starting the oral, you can start the oral. Do you understand? And you have to continue the antibiotic, right? And there are few things you need to do. One, early mobilization and early initiation of the oral intake. The reason is if you are not initiating the oral, patient will develop paralytic ileus. So you have to initiate the oral intake as early as possible if there is no contraindication. And you have to mobilize the patient as early as possible. You have to increase the oral intake to prevent the DVT. If the patient is having additional risk factor for the DVT, then you have to put the stocking. You may have to consider about the enoxaparin. You may have to consider about the physiotherapy, those kind of things. Right? So early mobilization, right? Adequate fluid intake, prevention of DVT measures. Right? And of course, you have to monitor the urine output. Maybe a patient usually might be on catheter immediately after the surgery. You can monitor the urine output hourly and check whether the urine output is good. Sometimes patient might have internal bleeding. You can't understand or you can't identify. Then you have to monitor the vitals, check the pulse rate, check the blood pressure, check the urine output. Then only you can have an idea whether the patient is bleeding or not. And never ever forget to give the pain relief, because that is the most important part. You have cut the patient will have severe pain, so you need to give adequate pain relief. Either you can give the opioid, you can give the NSAID, whatever, you have to give adequate pain relief. Right? So the immediate postpartum or post-operative care is the mandatory one for the patient. Right? So especially in obstetrics, in gynecology, mostly we are doing few surgeries. So there are so many surgeries. The common surgeries are hysterectomy and ovarian cyst. So I'm just going to show you for the interest purpose how we are operating ovarian cyst. I will show you quickly. You all can see it. Yeah, this patient came with ovarian mass. So you can see this is the umbilicus, this is the uh, pubic symphysis, this is the umbilicus. So as it is a ovarian mass, it's a large mass. So what we can't remove the mass with the phalansteal incision. There are several type of incisions. So here, if you put the incision in the lower part, that is called phalansteal or lower transverse incision. So the lower here, what I'm going, this is the lower vertical incision. Why I'm cutting the lower vertical incision? Why we are cutting it? To get the more access, then only we can take the uh, uh, tumor out. Okay, right, perfect. So give me 1 minute. I will share the sound. Right, perfect. So you can see we are cutting the lower midline, right? So you can see the cut layers, right? And we are cutting through
It's
the cut
very big.
layer. Once
It's
you cut the cut
that
layer,
bad.
you have to cut the
Because it is big.
right. So when you go inside, so she might have some additions, right?
Like this.
Right.
Irritate one.
So this is how we remove the additional itis. So the omentum is adhered to the anterior abdominal wall. First of all, you need to remove the adhesions and you need to hide. Okay. So you need to remove the adhesion. You have to hide. Once you remove the adhesion, yeah, now you have to go to the abdominal cavity, right?
It is running out.
And see
Means
the
Space.
focus the light.
uh, and see the omentum. Now, when you are operating for the ovarian tumor, you have to look for the secondary malignancy features. So, right, whether the malignancy, because malignancy was
Yeah,
in
it's
the, so
look
now you can see the
malignant.
big, big ovarian mass. Right?
They are
You can see the big ovarian mass with the highly vascularity. So it's seems like a malignant, right?
hemorrhagic lesions.
You can see a lot of vascularity, right?
Right side, yeah. And
So this is you can see this is the
light
you,
paramorca,
you,
please.
you can see the
Focus the light.
uterus. This is the left-sided ovarian large mass, right? To remove the ovarian mass
POD,
without
right?
rupturing the ovarian cyst only, you have to go with the midline incision. Otherwise, what will happen if you damage the ovarian mass? What will happen? So it will
Even
spill into
21
the
only.
uh, uh, peritoneal cavity. So the malignancy will spill into the peritoneal cavity. So you are upgrading the ovarian malignancy. So then you may have to give the chemotherapy. That's why without rupturing the cyst, you need to remove the ovary,
Miss api the fact
right? You need to remove the ovary. Now we have removed the ovary. Now we are removing the
tumor no.
uterus, right? Right? Removal of uterus. Now uterus has been removed. Once you remove the uterus, if it is an ovarian mass, if you are suspecting ovarian malignancy, you have to do the commendectomy. It's a colic commendectomy. So we already studied what are the steps in the staging nephrectomy. So midline incision, uh, thorough inspection of the endometrial cavity, uterus, ovary, fallopian tube, pelvic cavity, inner surface, undersurface of the diaphragm, then your,
Excuse space is
no, your
No, it will run out, sir. I knew that only 405 GB left.
spleen, And momentum, right, mesentery, oval surface, everything. After that, you have to do the intervention like total abdominal hysterectomy, plus bilateral cervical oophorectomy. And of course, you need to do the intracolic momentum or maybe a complete appendectomy. And there is a secondary deposit.
Momentum is
You need
full
to
of
remove the
fat.
secondary deposit. Okay, so you have to remove the momentum. We are removing the momentum. Once you remove the momentum, right now the momentum remove, uterus remove. Now you have to check the bleeding because it can cause intraperitoneal bleeding and patient might die. So this is just this is we called catheterization. So you have to open the blood vessel. Okay, so you need to the hemostasis. Once you achieve the hemostasis, now right. Now check for the counts. Everything, all the counts is correct. Now this is the time to close it. When you are closing, here you can see this is the effective, right? This is the layer. So you need to close each layer separately. First of all, the cut layer, then finally fill. Now you can see closing the rectum. Once you close the rectum, right? So you can prevent the cranial formation. If you are not properly closed, it's a high risk for uh, I think that you are closed here. Now the rectus sheath has been closed. Okay. Now it's closed. Second one is we have to close the uh, fat layer. Finally, once you close the fat layer, we are closing the skin. So if it is a midline, we can close with the skin with the nylon, interrupted, or maybe stapler. So here we are closing with the step. You can see enter position now. It's closed with the stapler. So we made a incision from the pubic symphysis above the umbilical and remove excess. And
Count, sir?
now it's closed.
Sure. Thanks, sir.
Right? Any question? So what is the POA size mass was it? It is 24 week size, a big mass. A big mass. Yeah, any question? Any question? So what is the current condition of the patient? She's okay. She went to the chemotherapy. Now she's doing well. It has been done around 8 months ago. Now she is okay. She came to the clinic 2 months or no, 6 weeks ago. She's okay. So here the take-home message is you need to know how we are preparing the patient in a pre-operative time and how we are managing or monitoring the patient in the post-operative time. Those are the two major things as a house officer you need to know that, right? And you will get MCQs and it is very important for your theory exam as well. Why suture is stapler other than normal stitching? No, it's you can do both, but if it is a midline one, if you put stapler, it's you need to put a large area. No, the stapler is okay, right? It's easy for us. You have to remove the midline stapler maybe in a week time. Any question? If you don't have question, yeah, we will stop this class. And sir, when will we start the Viva class? Yeah, we'll start by next month, right? So I'm going to start the exam series probably by this month end, and I'll give the restreaming of this Viva class through the platform so you can access it. Once the exam finish, we will start the proper Viva class And if this if this corona is reducing, I can arrange the practical session. You can get the permission from the ministry and you can do the clinical attachment with me. So I will teach you while you are coming to the ward. Can you explain the time interval to check the vital in post-operative? So 15 minutes, every 15 minutes for first 1 hour, every 30 minutes for next 2 hours, then hourly for 4 hours. When we can use the app, actually you can log in and get the approval. So we will approve from the backend, and then after that you can use it from today. Is that switch material used to internal organ and externally or skin different? Yes, of course. So the switch material we are using inside is usually, not usually, it's always absorbable. But outside you can use absorbable suture material or non-absorbable suture material. Can we join to the restreaming Zoom class without platform? Yes, of course, you can join to the restreaming Zoom class. No, the classes will be through the Zoom, through the platform. Yeah, of course. The app will help you a lot because it's basically developed for you only. Bowel preparation before surgery. Yeah, of course, you have to give enema, and it's usually we do for 3 days, and you have to keep fasting. And the previous day to the surgery, you have to give 2 days prior to that, you have to give the semi-solid, and prior to the surgery day, you have to give the clear fluid, and meantime, you have to give the enema to clear out the bowel content. During the surgery, certain parts are inflated for more exposure. What gases are used and why? No. We are not using any gases for the open surgery. For the laparoscopy only, we are inflating the peritoneal cavity with the CO2, not the other gas. Why we are using the CO2 is because while you are operating, we are using the electric port and we are burning the abdominal organs and blood vessels. So if you use oxygen or oxygen inside, that what will happen when you burn? It might burn rest of the part as well. So that's why we are using the CO2. CO2 will not favor the burning part. No, that's why. What is the antibiotic given in post-op? That's again depend on the surgery. So if it is a normal uncomplicated surgery, you can give like one broad spectrum antibiotic cover and the anaerobe cover. But if you have a bowel damage or something, then you may have to give the gram-negative cover with the gentamicin as well. Now you don't need to download the app. First of all, you need to log in and create your account in the platform web. Then when you consume, automatically you can download. You don't need to separately download. It will direct you to download automatically. Okay, Harita. Okay. Right. So then we will stop this class today, and I plan to do a free paper classes as well as I did earlier. We will start again. I was a bit busy with this COVID votes and work. That's why I couldn't do the class for last 4 weeks. So I will start the free paper class as well. So nowadays the COVID number is coming down. So early last 2-3 weeks we were very busy. So I will restart the class again by next week with the free paper class. So this time also, sir, video watching frequency, that's up to you. It's 24/7. You can watch anytime. What is the password for the students who already attend your class? Your OGR number. Or you can reset, just go to the forget password option and reset it. Okay then. So we will meet by next week with another free paper series. Okay. Can we get access only from Android? No. You can get access through the Windows and Mac. In month time, you can get it through the mobile devices as well. Can you repeat the pre-medication given post-op preoperatively? Yes, of course. Ranitidine, Maxalone, and sodium citrate. Okay, bye. See you.